Hey, my name's Holly Nichols. I'm a nurse practitioner student at Auburn University, and I'm here interviewing Zoe today on the roles of a nurse practitioner. So I'm going to ask her 10 questions here. So number one here is, what is a nurse practitioner?
A nurse practitioner is a healthcare provider that is under a doctor that takes care of patients.
Okay, yeah, that's pretty close. So a nurse practitioner has gone to school to get a degree past their bachelor's in nursing. They hold either a master's or a doctorate degree, and they are able to treat patients within the clinic, so they can treat acute and chronic patients and manage them throughout their care. So number two is, what all can a nurse practitioner do?
Take care of patients, write prescriptions, admit people into the hospital.
Okay, yeah. So they can also do some procedures types in the office. They're able to treat the patients, diagnose them, manage their care, change their prescriptions and medications based off of what they need, and then also admit them and write prescriptions and things. Can an NP diagnose illness?
I believe so, yes. If they, based on their symptoms and treatment plans, yes.
Yeah, so an NP can diagnose treatment or diagnose illnesses in patients. Can an NP manage chronic and acute illnesses?
Yes.
Yes. They can manage chronic and acute illnesses, and they typically do that either in a primary care office or an urgent care setting, and sometimes even in an emergency room or a specialty office like an allergist. Do you think that a nurse practitioner has to collaborate with a physician?
Yes.
So in Alabama, a nurse practitioner does have to collaborate with a physician. A physician actually has to oversee 10% of their charts, but there are some states that do not require a nurse practitioner to collaborate with a physician, and some states that are trying to lobby for full practice authority so that nurse practitioners don't have to collaborate with physicians. Can a nurse practitioner order diagnostic tests like labs and x-rays?
Yes, so they can determine what treatment plans people need.
Yes, so an NP can order diagnostic tests, including labs and x-rays, even CT scans and things like that to treat patients. Can an NP do simple office procedures?
Possibly.
So a nurse practitioner can, so they can do sutures, they can put in stitches, they can splint. If you break your arm or anything, they can put a splint on there, and then they can also do like incision and drainages and things like that. So they can do simple office procedures. Can an NP write prescriptions, and can they write narcotic prescriptions?
Prescriptions, yes, but I don't believe narcotics.
So in the state of Alabama, it is actually different in every state. So in Alabama, a nurse practitioner can write prescriptions, and then in Alabama, a nurse practitioner can prescribe narcotics if they get a license to do so, and they have to apply to be able to do that. Can a nurse practitioner bill for their services?
I'm not sure. Possibly.
So nurse practitioners can bill for their services. Insurance providers require different things for the services, and some require a physician sign-off, but for the majority, they can bill for their services such as office visits and procedures and things like that. So what is the difference between an NP and a PA?
I think that the nurse practitioner is the one who's went to school for nursing, and the PA did not, but other than that, I'm not quite sure.
Okay, yeah, so a nurse practitioner goes to school for nursing first and then gets an advanced degree for their nurse practitioner, which is either a master's or a doctorate. And then a physician's assistant gets a different degree and then goes back for their master's, and theirs is actually focused on the medical model and not the nursing model. So PAs have a little bit different privileges. Some of them they are always overseen by a physician. There are no full practice authority states for PAs, and their services are a little bit different offered than what a nurse practitioner is able to do, and that also varies state by state. So that's the 10 questions. Do you have any questions about anything?
No, ma'am.
All right,
you.
thank you. So this is my second participant in my video for my questionnaire on the roles of a nurse practitioner. This is Mark Kova, and he's going to be answering some questions too. So the first question is, what is a nurse practitioner?
I think a nurse practitioner is a medical professional that's between a nurse and a physician. They can carry out some duties still under the care of the physician.
Okay, yeah, so a nurse practitioner, that's pretty much right. So a nurse practitioner is an advanced care provider. They have had to either obtain a master's degree or a doctorate degree to provide care for patients. They are able to see and manage patients on their own and also work in a variety of roles as a clinician rather than a nursing role. So the second question is, what can a nurse practitioner do?
Well, I think they can see patients on their own. They're still under care of a physician. I think they can do some diagnostics and things like that, order tests. But I'm not sure. I still think a physician must sign off on them. I'm not really sure. So they're still under someone.
So a nurse practitioner's role, they can diagnose patients and they are able to treat them. And they are able to manage their illnesses. So they can see them, they can have established patients the same way that a physician in a doctor's office can, and they are able to provide advanced care for them and also provide care in areas that physicians aren't able to provide care for all the population. Can a nurse practitioner diagnose illnesses?
I believe they can.
Yeah, so a nurse practitioner can diagnose illnesses. That's different than the role of a nurse. A nurse is not able to diagnose a patient, but as a nurse practitioner and advanced care provider, they can. So number 4, can a nurse practitioner manage chronic and acute illnesses?
I would think so.
So in the setting of a primary care office and urgent care, really any office that you would see a nurse practitioner in, they can see you for an acute visit, such as like a sinus infection or pneumonia or something like that, but they can also manage you. So they can manage conditions like diabetes and high blood pressure and things like that. So they can manage chronic and acute illnesses. So number 5 is, do you think a nurse practitioner has to collaborate with a physician?
I think so.
So in the state of Alabama, they do. In the state of Alabama, a nurse practitioner is required to collaborate with a physician, and that physician is required to oversee 10% of their work. That is different state by state, and there are some states that allow nurse practitioners full practice authority, which means that they do not have to work under a physician directly, and that does vary state by state. So number 6 is, can a nurse practitioner order diagnostic tests like labs and x-rays?
I think so.
Yeah, so a nurse practitioner can order diagnostic tests. They can do labs and x-rays. They can also order CT scans and things like that to help manage a patient's care. Can a nurse practitioner do simple office procedures?
I would think so.
Yeah, so nurse practitioners can do simple office procedures. Some of those include putting stitches in, doing incisions and drainages, removing stitches, casting a broken bone, putting splints on, and things like that. So they are able to do simple office procedures. Number 8 is, can a nurse practitioner write prescriptions, and can they prescribe narcotic medications?
I'm going to guess and say they can write prescriptions, but maybe not narcotics.
Okay, so nurse practitioners can write prescriptions, and then the narcotic prescriptions is actually a case-by-case state basis. Some states allow nurse practitioners to prescribe narcotics under the care of a supervision or physician, and then in most states the requirement is that you apply for a license to prescribe narcotics. And in Alabama, you can actually get your license to prescribe narcotic medications. Can a nurse practitioner bill for their services?
Not really sure if they can bill for their own or if they have to go through a billing system, so I would say yes.
Yeah, so nurse practitioners can bill for their services in the same way that a physician can. They are able to bill for a visit in the office the same way that you would any other medical professional, so they can bill for their services. And then the last question, number 10, is, what is the difference between a nurse practitioner and a physician's assistant?
That's a tough one. I really don't know the difference between the two.
So a nurse practitioner goes to school for nursing first. They first obtain a nursing degree. And then from there, they move on and they either get their master's in nursing with a postmaster's in nurse practitioner, or they get a doctorate for their nurse practitioner degree. And then a physician's assistant gets a 4-year degree prior to going to physician's assistant school. And then they get a 2-year degree in their master's in physician's assistant. So some of the main differences in those are physician's assistants have to practice under the direct supervision of a physician at all times. And then they do have some limitations on their prescribing authority, whereas nurse practitioners in some states don't have to work under the direct supervision of a physician, and then some states they have full practice authority on their prescribing rights as well. So it's a little bit of a difference. Physician's assistants have some more specialty roles that they can go into, such as surgery and things. And then nurse practitioners have different roles that they take on as well too. But they're both mid-level providers with their own differences.
Okay.
All right. Well, thank you for being my participant and going over the roles of a nurse practitioner.
Well, thank you.